With so much information flooding in about COVID-19, it can be difficult to absorb everything. So we turned to Facebook to see what questions you wanted us to ask health officials. Valley News Team's Katie Opperly joins us in studio to walk us through what you wanted to know and to give you the answers. Katie?
That's right, Andrea. We received over 100 comments. We won't be able to address them all right now, but to start, we picked 3 questions that were asked multiple times in the comments. Daycares were a large topic of concern, people asking if they will remain open, and if they do, how can it be ensured that they remain safe? We asked the infectious disease director in Minnesota.
We're asking that childcare would remain open during this time, but our recommendations for child care providers as well as the children are the same. If anyone has any symptoms, so respiratory symptoms and fever, children should not attend daycare with those symptoms. And certainly if a child care provider has those symptoms, they should not be providing care.
Several people also wanted to know who is most at risk. 2 people specifically wanting to know more about children who have pre-existing conditions. Experts say it's the same recommendation for kids with those conditions that it is for adults.
Our recommendations are that anyone that has an underlying health condition, so that includes diabetes, heart disease, lung disease, asthma. Those are all situations in which you want to be more cautious because individuals could be at higher risk for severe COVID-19 illness.
And with the recent news that Minnesota is changing its testing restrictions, many people asked, when should you be tested? And why not test everyone? In Minnesota, health officials are using their tests where they feel they are needed most.
We feel that it's our responsibility to make sure that we continue to have the capacity to test the most vulnerable Minnesotans. And so that would be individuals who are hospitalized, our healthcare providers, and individuals living in congregate settings.
She goes on to say that if you don't fall under this category and you only have mild symptoms, stay home and stay away from others. If your symptoms are more severe, that's when you should seek medical attention. Andrea?
All right, thank you, Katie. For more COVID-19 resources, as well as the latest closings and cancellations, we have links on our website, valleynewslive.com, and also on the VNL News app.